The cause of most movement disorders is unknown. For example, in Parkinson's disease, we do know some contributors to causing this disease, and they include environmental toxins, genetics, certain perhaps diets and dietary exposures. But for the most part, that doesn't really account for people getting Parkinson's disease in its entirety. There are other illnesses that have a very strong genetic component to them, such as Tourette's syndrome and Huntington's disease. The people at risk for movement disorders, especially in Parkinson's disease, are those that have multiple family members that have Parkinson's disease. There's a long history, multiple generations. People that live in rural areas and farming areas where there's well water drinking because the pesticides and herbicides that are used in farming can leak into the groundwater, and then patients will drink that. And there are other risk factors, but they're much lower on the list than the two that I just mentioned. Movement disorders are treatable. It depends on what movement disorder we're talking about. For most of the movement disorders, we don't have a cure. We can modify symptoms, we can control symptoms for X amount of time with medications and other surgical techniques depending on the type of movement disorder that we're dealing with. Most of the movement disorders are progressive in nature. We adjust medicines or other treatments over time to take care of those symptoms.